Hi there, it's Steve Weir from American Integrity Restoration. First off, I hope you all are faring well out there during these uncertain times for all of us. I wanted to take a couple of minutes this morning to talk about the differences and some misconceptions about cleaning versus disinfection when we're talking about the coronavirus. Since 2016, we've been providing disinfection services to many different types of facilities, whether it be healthcare, multifamily residential, commercial, and some industrial and institutional properties. We've placed a big emphasis on safety, so our staff members have undergone training both on safety, certainly the proper wearing of personal protective equipment, or PPE, and they've also attended manufacturers' training on the proper use of their equipment. So my point is, not all cleaning is disinfection. A lot of companies now today are out in the field claiming to be experts in disinfection services, and given the tremendous awareness of the pathogens around us, particularly the coronavirus, some companies are performing spray and wipe only of chemicals. So this can leave a tremendous gap in coverage. A lot of times the chemistry being used is not effective against the coronavirus. You may not end up with a disinfection at all. Other companies are coming out to fog or spray, a mist, a vapor, and they're not doing any hand cleaning. And they're also calling this disinfecting. So we recommend the use of a combination of both of those techniques in most circumstances. If there's a potential for the surface to have dust, dirt, grease, oil, other contamination, or gross contamination, it must be removed prior to applying any fog, vapor, mist, or spray. Again, the technique should comply with the manufacturer's recommendation on the label, which is a big point to note. So some details to consider when you're hiring a contractor. One question to ask is, are the employees protected properly? Are they wearing personal protective equipment? And are they trained to wear it properly? Did you know that when an employee wears a respirator that they must be not only fit tested, but they also must be medically cleared to wear it? If not, this could be an OSHA violation. And it's hard to believe that in this day and age, somebody would send an employee into a work environment not properly protected, but it's happening. What product are they using to perform the disinfection? A lot of people are using fogs, mists, sprayers, and that type of technology, but not every product is rated for fogging. Furthermore, are they using it with the label instructions? Before they apply that fog, are they hand cleaning and making sure that they've removed all gross contamination? What type of byproduct is the cleaning product leaving behind? Many products will leave a residue, silver oxides, corrosives, any ammonia or bleach-based products, chlorine-based products, will leave behind a residue that needs to be removed. With our patented SteraMist technology that we're deploying, there is no harmful residue left behind. When we're done applying it, byproducts are oxygen and water, so there's no wipe, no harmful residue. This can be applied in a matter of minutes and be ready to reoccupy the area in a matter of minutes. So that's something to consider. What type of insurance is your vendor carrying? Dealing with infectious disease remediation is always recommended that your vendor carry a pollution policy. So without that, they may not be covered, and neither might you should something happen. Another question to ask is, what level of experience does the vendor have in this type of remediation? Did they just start cleaning a month ago? Certainly experience plays a big factor when we're dealing with this type of pathogen. Is there an employee protection plan in place? You certainly want a vendor that monitors their employees. You don't want an employee showing up to a site cleaning when that employee is ill or not feeling well. If you or your team are performing cleaning in-house and you're unsure about disinfection relative to the coronavirus, we're happy to help consult just to make sure that you're leaving your staff, your residents, and your customers safe. Good luck and stay safe out there.